Hello everyone, welcome back to the channel Last Night Dentistry. Today we are going to talk about a very important group of conditions in oral medicine, immune mediated diseases affecting the salivary glands with a special focus on Sjögren syndrome. So this is not just a theoretical topic, it has a huge clinical importance because these patients often suffer from severe dryness and have increased risk of complication. If you understand this topic well, you will be able to diagnose and manage these cases confidently in both exams and clinical practice. Let's start with the basics. Before that, please subscribe our channel as it will keep motivating me in making such videos in the future. First, let's understand lymphoepithelial sialadenitis, also called LES. This is basically a chronic autoimmune attack on the salivary glands, especially the parotid. What happens is that T lymphocytes heavily infiltrate the gland and start destroying the SNI, the parts that produce saliva. At the same time, the ductal cells react by proliferating and forming structures called Epimyoepithelial Islands. This pattern is the histologic hallmark of Sjogren syndrome. In simple words, the immune system mistakenly attacks the patient's own salivary glands tissue. Now, let's move to the Sjogren syndrome itself. Sjogren syndrome is a systemic autoimmune disease that mainly affects women, especially in middle age. It has two forms: primary Sjogren syndrome, only salivary and lacrimal glands are involved, producing the classic Zika complex, meaning dry mouth and dry eyes. Secondary Sjogren syndrome occurs along with other autoimmune diseases like rheumatoid arthritis or lupus. The immune system attacks the glands, leading to progressive destruction of saliva and tear producing cells. Now, let's talk about how these patients present clinically. The most important complaints are xerostomia, which means severe dry mouth, and xerophthalmia, meaning dry eyes. Patients feel burning sensation, difficulty in swallowing, and they are highly prone to rampant root caries and oral candidiasis. About 45% of patients also develop bilateral Doffy swelling of the parotid glands. This swelling is usually painless. Because of dryness, the eyes become red and irritated, and the cornea can develop keratoconjunctivitis sicca. Now, diagnosis of Sjogren syndrome is based on a combination of clinical findings and tests. We can use the Schirmer Test to measure tear production. A positive labial minus salivary gland biopsy shows dense lymphocytic foci, also called the focus score. Blood tests often show positive NT-RO, also called SSA, NT-LA, or SSB-ANA, and rheumatoid factor. Sialography may show a characteristic shotgun palate appearance due to pooling of dye. Now coming on to the histopathologically, the picture is very characteristic. You see heavy infiltration of T lymphocytes destroying the SNI. The remaining ductal cells form Epimyoepithelial Islands. In advanced cases, germinal centers may appear resembling lymphoid tissue. This pattern is called lymphoepithelial sialadenitis and is the hallmark of the disease. It is important to know that differentials. Similar bilateral parotid swelling can be seen in HIV-associated salivary gland disease with multiple cysts, sarcoidosis, especially Hereford syndrome with granulomas, and MALT lymphoma, which can actually develop in long-standing Sjogren syndrome. So always rule out these conditions. Moving on to the next slide. Unfortunately, there is no cure for Sjogren syndrome. Treatment is symptomatic and supportive. For dry mouth, we use salivary substitutes, pilocarpine, sugar-free gum, and strict oral hygiene with high fluoride to prevent caries. Dry eyes are managed with artificial tears. Regular dental checkups are extremely important because these patients are at high risk of rampant decay and fungal infections. Here are most important high yield points for your exams. That the most common autoimmune salivary gland disorder is Sjögren syndrome. Classical presentation is middle-aged female with dry mouth plus dry eyes. Histologic hallmark includes lymphoepithelial sialadenitis with Epimyoepithelial Islands. This is important. Now, in long-term result, you can see from here. Always remember the sicker complex and female predominance. Moving catch to the next slide. Quick revise question. Most commonly autoimmune disease affecting salivary gland. As I said, Sjogren syndrome. What we have to see major long-term complication we can see here is MALT lymphoma, and best confirmatory diagnostic test is mini salivary gland biopsy. Focus the score. These are frequently asked concepts. Just give it a read so you have a great grip on this topic. That's all for today lecture on immune mediated immune mediated salivary gland diseases. This topic is beautifully connects oral medicine, pathology, and clinical practice. Revise the clinical features, histopath, and management points thoroughly. If you found this helpful, please like, share, and subscribe. Drop your questions in the comments and tell me which topic you want next. Thank you so much for watching. Keep studying smart. Take